Welcome to the third video of the lower limb series. In this video I will be talking about the nerves and blood vessels of the lower limb. Neurovascular structures leave the pelvis to enter the lower limb by three different routes. The inguinal route lies on the anterior side of the pelvis between the innominate bone and the inguinal ligament. The obturator route lies on the anteroinferior pelvis. It is an opening or canal through the obturator membrane and through the obturator foramen. The gluteal route is on the posterior side of the pelvis. It passes through the greater sciatic foramen, which is the greater sciatic notch closed off by the sacrospinous ligament. I will begin by discussing the vasculature of the lower limb. The blood supplied to the lower limb comes from the branches of the common iliac artery. These are the right and left common iliac artery formed by the bifurcation of the aorta. They divide into external and internal iliac arteries on each side. The external iliac artery travels through the iliac fossa on the lateral side of the femoral vein and enters the thigh through the inguinal route to become the femoral artery, which I will discuss later. The internal iliac artery descends deeper into the true pelvis and gives the following branches to the lower limb. The superior and inferior gluteal arteries leave the pelvis via the gluteal route. The superior gluteal artery exits the greater sciatic foramen above the piriformis muscle to supply blood to the gluteus medius and minimus muscles and some other tissues. The inferior gluteal artery exits the greater sciatic foramen below the piriformis muscle. It is a major source of blood to the gluteus maximus muscle. Another branch of the internal iliac artery is the obturator artery. It travels along the pelvic brim and leaves the pelvis via the obturator route. The obturator artery supplies blood to the muscles of the medial compartment of the thigh. Here in the anterior thigh, we can see the femoral artery. This artery supplies the muscles of the anterior thigh. It gives off the Profunda Femoris branch, which branches into medial and lateral circumflex arteries. These arteries supply blood to the head and neck of the femur. The femoral artery travels down the thigh and eventually pierces the adductor magnus muscle at the opening called Adductor Hiatus to arrive in the popliteal region. Here the femoral artery changes its name to the Popliteal Artery. In the posterior compartment of the leg, the popliteal artery branches into anterior and posterior tibial arteries, which both supply blood to the leg. The posterior tibial artery gives rise to the peroneal artery seen here. The posterior tibial artery finally terminates to form the medial and lateral plantar arteries. These supply blood to the plantar surface of the foot. Note the position of the anterior tibial artery as it enters the foot. The anterior tibial artery continues on the dorsum of the foot, where it terminates as the Dorsalis Pedis artery. The lumbosacral plexus is made from L4 to S3. It consists of sacral plexus S1 to S3 and the lumbosacral trunk L4 and L5. It is visible here lying on the piriformis muscle. It gives off the sciatic nerve. On the either side of the vertebrae, these are the right and left sympathetic chain, where the preganglionic sympathetic fiber synapse. Some postganglionic sympathetic fibers travel from the sympathetic chain to the roots of the lumbar plexus. This is the obturator nerve. It lies on the medial side of the psoas muscle. It is formed from the lumbar plexus and will exit the pelvis via the obturator root to innervate the muscles of the medial compartment of the thigh, also called the adductor compartment. This is the lateral cutaneous femoral nerve. It supplies cutaneous sensation to the lateral thigh. This nerve is sometimes irritated by tight belts as it enters the thigh in the area of the ASIS. This is the femoral nerve. It is also a branch of the lumbar plexus. In the pelvis, the femoral nerve lies on the lateral side of the psoas muscle. Then it leaves the pelvis via the inguinal root to innervate the muscles of the anterior thigh. Notice that as it enters the thigh, the femoral nerve lies immediately lateral to the femoral artery. It is important to remember the relationship of these three nerves to the psoas muscle in the pelvis. The obturator nerve on the medial side, the genitofemoral nerve on the top, and the femoral nerve on its lateral side. Here in the gluteal region, we see the superior and inferior gluteal nerves. The superior gluteal nerve leaves the pelvis from the greater sciatic foramen above the piriformis muscle. It innervates the gluteus medius and minimus muscles. The inferior gluteal nerve leaves the pelvis from the greater sciatic foramen below the piriformis muscle. It innervates the gluteus maximus muscle. Recall from video 1 that any changes to the superior gluteal nerve causes weakness in the gluteus medius and minimus muscle, leading to a characteristic imbalanced walking called the Trendelenburg gait. This is the sciatic nerve. It is a large nerve from the sacral plexus. It exits the pelvis from the greater sciatic foramen below the piriformis muscle. It descends in the posterior compartment of the thigh, innervating all the muscles in that compartment. Here is the posterior thigh. We can see the bifurcation of the sciatic nerve into the tibial and common fibular nerves. The tibial nerve runs through the popliteal fossa to the posterior leg deep to the soleus muscle. It supplies motor innervation to the muscles of the posterior compartment of the leg. Finally, it bifurcates to form the medial and the lateral plantar nerves. These supply the intrinsic muscle of the plantar foot. The common fibular nerve winds around the head and the neck of the fibula close to the surface. The common fibular nerve then divides into superficial fibular and the deep fibular nerves. The superficial fibular nerve innervates the muscles of the lateral leg, and the deep fibular nerve innervates the muscles of the anterior compartment of the leg. The common fibular nerve is sometimes injured near the popliteal fossa, since it is close to the surface in that area. This nerve controls the anterior and the lateral leg muscles, which are dorsiflexus and everter of the foot. Patient with a common fibular nerve injury present with foot drop, meaning they fail to properly lift their toes when walking. This is called the flapping gait, since they don't have a heel-to-toe walking pattern.